Hello. Today we'll discuss about ultrasound imaging or ultrasonography. It is one non-invasive method and also non-ionizing because previously we have studied X-ray, CT scan. In those cases we are using X-ray as the energy source which are ionizing in nature. Then we have also seen that magnetic resonance imaging where we are using some magnetic field, we are creating high intensity or magnetic field there, and but in this case this ultrasound imaging, it uses the ultrasound as its energy source. Actually this ultrasound is non-invasive, it is non-ionizing radiation, uh, and externally it has been applied, and non-traumatic, but it also apparently safe because it uses acoustic signals or sound. The application of this ultrasound in medical field is based on sonar technology. So you can see here sonar means it is just sound navigation and ranging. As in case of your radar, we all know radar. Similarly, we have some radio detection and ranging is your radar. Similarly, here we have sound navigation and ranging. It is called sonar. Sonar. So these sonars, how it works? Actually, these are the sound pulses. It has been generated by a transmitter or a source, and then it will travel on the medium, and if it has some obstacles in between its path, then from that obstacle it will, that signal or that sound waves will reflected back. We call them echoes. After they bounce off underwater objects, normally this sonar technology is used in water or in fluid medium. They can allow the determination of distance, direction and mapping of the objects underwater. Acoustic waves are easily transmitted in water, but they are reflected from an interface according to the change in their acoustic impedances. We all know what is impedances. Acoustic impedances is a special, that means that is the impedance, that is the hindrance that has been shown by that particular medium or that particular your any obstacle. So that is called acoustic impedance of that obstacle or medium. It is differ from different in case of your medical field, acoustic impedance is differing from tissue to tissue and different organs like blood vessels, we have kidney. So different organs have different acoustic impedances. Except bone and lungs, all our tissue composed of water. That is why these acoustic waves, they can travel through these, or they can be transmitted through as waves inside these tissues. Hence, diagnostic ultrasound is applied for obtaining images of almost all internal organs like kidney, liver, spleen, pancreas, bladder, major blood vessels, cyst, tumors, thyroid glands, eyes and fetus. All these can be detected or can be diagnosed using this ultrasound except bone and lungs, because lungs doesn't contain any water, and similarly bone is also not. So that is, these two things cannot be imaged using this acoustic waves or this sonar principle. So here for this acoustic imaging technique, we are using the source of energy at ultrasound, and ultrasound means which you can't hear. It is above the frequency range of ultrasound is above our audible frequency range. So audible frequency range is from 20 Hz to 20 kilohertz. But now in this case, ultrasound has a frequency which is greater than 20 kilohertz. Basically, the diagnostic ultrasound has the range of 1 to 15 megahertz. Actually, this is in the range of RF signal, radio frequency, but radio frequency signal, they are electromagnetic signals, but these acoustic signals, they are mechanical signals. Their source is not from magnetic source. So that is the difference. And other difference is that these acoustic signals or electromagnetic signals, they are generated, they are travel they are transverse waves, but these ultrasound or this acoustic signal, they are longitudinal waves. So longitudinal waves means the particle of the medium move in the same direction, or you can say it is a parallel to the wave propagation direction. So that means if the wave, this direction of propagation in this direction, wave is also moving in this direction like this. So this is the wave transfers energy through the motion of regions of compression and refraction. So that means if you imagine, if it is wave, then it will be compressed somewhere, then it will be refraction. So relax. So in this manner, they will move in the direction of propagation. The propagation of wave depends on the elastic property of the medium. Without medium, this acoustic signal cannot travel, unlike the electromagnetic waves. So in this case, as they are following this, the wave property, so they require one medium for propagation that must be elastic, must have elastic property. So depending upon those elastic property of the medium, this acoustic signal will face the acoustic impedances. The characteristic acoustic impedance you find Z of a tissue determines how much resistance a sound wave encounters as it passes through a particular tissue, and affects both transmission and reflection of the ultrasound wave at boundaries between different tissues during the medical imaging. So that means the whole game is about the acoustic impedance, because as the acoustic impedance changes, the transmission and reflection at the interface of different mediums will differ. So it can be given by this characteristic acoustic impedance can be given by the relation, this Z is a characteristic impedance or acoustic impedance is equals to rho C, where rho is the density of the tissue and C is the speed of your acoustic signal or sound waves inside the tissue. So this is the fundamental relation. What is the acoustic impedance of a particular tissue? It can be determined by knowing its density and also the speed at which the sound is moving inside the tissue. When the amount of energy reflected, because let us say this is your wave traveling, and now from this interface, this is one medium, it has a index, it has a acoustic impedance Z1, and the second medium has acoustic medium Z2. Then from here some will be reflected and some will be transmitted. So, we have incident waves, then we have reflected waves, and also this is your transmitted waves. Some part of this will be transmitted. So, among them we can have a relation, because how much wave or how much energy has been reflected at the interface of these two mediums having impedances Z1 and Z2 can be calculated using this formula, and that is defined one reflection factor. We call that reflection factor. The amount of energy reflected is given by reflection factor. So, it depends on the impedances, individual impedances of this interface of these two mediums. So, it can be defined as the reflected factor, reflection factor is equals to the impedance of second medium minus the impedance of first medium divided by impedance of second medium plus is the ratio of these two, difference and addition of these impedances. If this signal is normal incidence, means this is your normal and this signal is normal incident on this mediums Z1 and Z2, it is the interface. Okay. Now, when it is, you can mark here, this is the other way, when the incident wave having some, it is an oblique incidence, means this incident wave is not normal, it is not, it has some angle. So, this is called theta I, theta I means incident angle. So, this incident angle, then it will be travel in this the second medium, this angle is theta t or transmitted, okay, and this is your reflected wave. Reflected, you know that the angle will be the same. So, now in this manner, if you have to calculate what is the reflection factor in this case for oblique incidence, then this is the formula we can find. It will be equals to Z2 cos theta I means incident wave angle minus Z1 cos theta t, theta t is your transmitted angle, divided by Z2 cos theta I plus Z1 cos theta t. So, this is the formula for oblique incidence. Now, once it has been passed, the wave is passing through it and it will move down, again it will come back, refract, due to some reflection it is coming back. So, when it is, let us say here we have one obstacle, from this obstacle this wave has to be come back, okay. So, it will take some time, while moving here and again coming back. So, if we want to capture this signal, let us say we have two receiving things, like here in this case you can mark this transducer is transmitting the wave, it is reflected from the interface of this organ, again it is transmitted back or reflected back to this receiver part. So, this path, if this path is D, it is moving to this obstacle, hitting that and coming back. So, at this this reflected path is also D. So, the total path, transmitted path D, reflected path is D. So, total path is 2D, okay. And if we know what is the velocity of this inside the tissue, velocity of the acoustic signal inside the tissue, so that is equals to C. So, from this we can calculate how much time this echo is taking, so that the delay can be found, means we can, by looking at the delay, we can found that what is the round trip distance, what should be the d, because we, this transmitted signal is moving here, then hitting that organ, then coming back. So this will take some time. If this is your t, it has a round trip time from here to here, again coming back. So if the time is delay is t, transmitting and receiving, the delay in between these two is t, then we can find out what is the distance. So here it can be written as the delay t to each echo to the round trip distance to the object is 2d divided by the t. So that means it is t equals to 2d divided by the c. So this is the delay we can calculate easily. The echo range instrument consists of a piezoelectric transducer. So this transducer is one piezoelectric transducer. This piezoelectric transducer, actually it converts the electrical form of transmitted to acoustic pulse and reconvert the received echo from target into the electrical signal, means vice versa. It will convert any pressure or vibration to electrical signal, and again electrical signal to pressure or vibration, mechanical signals. So these signals were then amplified, then it will be amplified, and the signal were then amplified and display on the time record on this oscilloscope. This is like monitor. We can also use oscilloscope to visualize this. This type of display was known as A mode display. We will see what is different types of mode of scanning modes or imaging modes. The average speed of wave in biological tissue can be given by, this speed can be equals to this beta by rho naught, means it is c equals to root over of beta by rho naught. So this is your velocity of or speed of wave, acoustic wave inside a tissue, where this beta is the modulus of elasticity, and it can be related by this equation. So change in pressure divided by the change in their volume. So delta P, if there will be any change, then what is the equivalent change in their volume. So this average speed in tissue is taken 1540 meter per second. Here you can mark, we have different velocities while passing this acoustic signal, have different velocity while passing through these different organs or muscles or different tissues. Like for collagen, this is shown, it is around your 1650. Similarly muscles, if you it will fall around 1600. Blood is around 1550, like that. Milk, inside the milk the velocity will be less than 1550, and fat, the slowest one you can see here 1480, 90, like that. So in that manner there are different velocities while the wave traveling inside this different tissues, and they are depend upon the density of that particular medium and the elasticity modulus. Okay. So as the ultrasound beam encounters tissues of different acoustic impedances, velocities are altered such that returning echoes are received by the receiver at different times, and echoes are also different intensities, because these tissues are also having different attenuations. So two things we are capturing from the echoes. One is the time period it is taking, or the round trip time or the delay, and second one is the attenuation or the intensity of the capture signal, because due to the attenuation inside those tissue. Different tissues, they have different attenuation, so the echoes which is coming back, they are coming at different intensities. So the difference in time, intensity and velocity in the tissue, they are used by the computer to generate an image. This is the principle of image generation using ultrasound. If the time taken by the ultrasonic wave to move from its source through a medium or a tissue, then reflect from an interface and return to the surface source can be measured, then the depth of penetration is equals to the velocity at which it is travel inside the medium into the time taken divided by 2. So, this is the range or this is the depth of penetration. Now, the transducer. The transducer, basically we are using piezoelectric transducer, that contains one piezoelectric crystal. We can see here the main is this piezoelectric crystal, and this crystal, now it will vibrate. Once you want to capture this, echo will vibrate it, and once it has been vibrated through this wire, the equivalent current or voltage can be captured, and we can take that for amplification. So, which can be converted to its equivalent electrical signal. Basically, these piezoelectric crystals, they are also natural occurring like quartz, and some of them are synthetic, because we can use using a synthetic one, you can have any, you can get any shape, you can mold them to any shape. So, some of them are barium nitrate and lead zirconate titanate. So, these are two different types of synthetic piezoelectric crystals. Then 3 parameters are used for optimizing this transducer according to their applications. First one is frequency. Actually, with increase in frequency, the sound beam becomes more directional and the axial resolution improves, but attenuation increases because penetration decreases. Frequency if increased, then attenuation also increased. As attenuation increases, the depth of penetration decreases. Similarly, active element diameter. As the transducer face diameter increased, the beam width decreases, and therefore lateral resolution improves. Beam width increased means more directional. Now, next one is focusing. Focusing a transducer is a mean of minimizing the beam width, means narrowing that. We are creating a narrow beam and adjusting the focal zone to give optimum result for a particular examination. They are giving very sharp pictures. Acoustic lenses can be used to shape the ultrasonic beam pattern. Now, here you can mark, if this is the scanning method, here we can move in these two directions, scanning direction in this x and also this elevation is y. So, we have arrays of elements, so it is scanning in particular direction. So, this is called your acoustic lens. So, here we have two directions, as in case of azimuth, another one is elevation. These two information has been captured for generating the image. Now, use of ultrasound can be in medical can be for two purposes. One is for therapeutic, where they are using high power ultrasound in terms of watt per centimeter square, and diagnostic ultrasound, which is having the power less than, it is below less than 100 milliwatt per centimeter square. And in some cases they are also using some continuous wave ultrasound, that is also called Doppler, using the Doppler effect, or they are called Doppler ultrasound. Basically used for in case of fetal heart detection and your blood flow measuring, and in some cases for detecting any abnormalities, any cyst, any type of like cancerous cell, all these things, they are using pulsed wave mode. Two different modes or different types of diagnostic diagnosis are used. Then the blocks, the prominent blocks of this ultrasonography machine, the first one is a probe, or that it contains your piezoelectric transducer. Second one is pulse repetition frequency generator, that will repeat the frequency at a particular signal or duration, and these are moving through this probe, and that acoustic signal will be generated and it will travel through the tissue, then reflected back by the receiving end, and that received signal is amplified using one wideband amplifier, which have actually gain of 80 to 100 dB, and then once it has been amplified, then they have to be detected using some demodulation circuit. So, we are capturing the baseband signal after detection, and that baseband signal or that signal will again amplified using some video amplifier or log amplifier. Then we have another time delay unit. This delay is a normally it is generated and introduced inside that pulses, and next one is time base and time marker. These three are basically used for display purpose, and that has been displayed, that capture signal after detection, that has been displayed on the oscilloscope or CRT monitor. Now, imaging scanning modes, we have different scanning modes. We have a bistable scanning, only black and white image we can capture. Once this black and white image captured, if you want to carry on any execution on that, then you have to convert that to analog to through that image through analog to digital converter, which has grayscale imaging. Then we have the grayscale can be of 8-bit. 8-bit grayscale means 2 to the power 50 to the power 8 equals to 256, means the scale contains 0 to 255 ranges. And now next one is A mode, what we have discussed previously, amplitude mode. It displays the amplitude of individual echoes as a function of distance or time on the cathode tube, and it can be determined, it is helpful determining the cyst and solids. Similarly, B mode, that is your brightness mode, display echoes individually, spots, it can individually it can spot, you mark here, difference in amplitude of returning echoes manifest as different brightness or dots. Using many picture elements, these numerous dots can be arranged such a way that to appear different sets of gray and good visualization. This one is a better used for better visualization. Next one is M mode. M mode is nothing but the B mode in motion. So, that means application of B mode to a moving structure or varying time. So, the examples of these different modes when it has been used, one is echocardiogram, gives the movement of valves. So, the structure of heart is displayed as a function of time. This is the example of your M mode. Similarly, in the A mode, echoencephalography can be determined by the location of the problem in the brain. We are using the amplitude mode, and for scanning the eye, we are using the B mode. Now these are the pictures you can mark here in amplitude mode. This amplitude has been shown as it is giving only amplitude, it is shown in case of only the tissue from which it has been captured, the echo has been captured, and the amplitude after attenuation, what is the amplitude, that has been shown here. Similarly, in brightness mode, all the points will be, we can get the brightnesses at different points, and you can mark here a picture, clear picture of that in dotted file, means different points with different values of grayscale. Okay, and in M mode, this is your M mode, anything which is moving, so that can be like your valve. So here you can get this curve. Now next other one is your Doppler scan. Doppler scan is used for any moving object and or continuous wave transmission. So this is your, in this case, Doppler effect that we have previously studied has been useful. So let us say this wave transducer is transmitting the acoustic wave which is passing through in this direction, and you can mark here the blood is flowing in the artery in a particular direction. This angle, let it be theta. Okay. Now we will see how to calculate this from using this Doppler scan. Now basically Doppler shift frequency can be used if delta F, which is equals to the F naught minus Fr. F naught is the ultrasound frequency emitted by the transducer, Fr is the ultrasound received frequency. So the difference among them is your frequency shift or Doppler shift, and it is related using the formula that is equals to 2 F naught V cos theta by C, where V is your velocity of the blood, C is the velocity of ultrasound in the blood, and theta is the angle, the transducer and the blood vessels in a degree, as I have shown in the previous picture. Now this relation can be easily find out. Delta F by F naught is equals to 2 V cos theta by C. Now we will see one example using this formula. Question is, a patient is undergoing diagnostic test to determine the cause of an underlying heart condition. Blood flow tests are done on the patient aorta using ultrasound imaging. Ultrasound of frequency 8.5 MHz is transmitted from a transducer through the skin into aorta. So that means the transmitted frequency is 8.5 MHz. Now the reflected frequency is found to be 8.495 MHz. So you mark, once it has been traveled through this the blood which is flowing through the aorta, then after it is penetrating that and it will be reflected back, the frequency we are capturing is 8.495. The angle the transducer makes with the skin is 15 degree. In this case, theta equals to 15 degree. Okay. So now we have to find out delta F, that is the Doppler shift in the frequency. Delta F equals to 0.005 megahertz, and we know that velocity of sound in the blood, average velocity, as we have previously known, it is 1570 meter per second. So now we have to use that formula, this previous formula, delta F by F naught equals to 2 V cos theta by C. So that formula, as previously you have seen, 2 V cos theta by C. So this formula we are applying. So now you can see this formula, and by applying those values, we can calculate what is the velocity of blood inside that aorta. That is found to be 0.48 meter per second. Thank you.